Shoulder pain is really common. 80% of people at some point will feel pain, tightness, or experience lack of movement in the shoulder. The shoulder joint is complex, and shoulder pain can be caused by problems with the joints, bones, muscles, or surrounding tissues such as ligaments that normally enable your shoulder to move freely. In this video, I'll quickly talk you through the anatomy of the shoulder to give you a better understanding of the most common root causes of shoulder pain, and then we'll run through the different symptoms that might be one or a combination of arthritis, shoulder bursitis, shoulder injuries and fractures, shoulder impingement. So let's get into it. I'm Harry Brownlow, consultant orthopaedic shoulder surgeon at Circle Reading Hospital, part of Circle Health Group, the largest independent healthcare provider in the UK with hospitals across the country. If you're over 40 and you have a particularly heavy fall where you've put your arms out to catch yourself, then there's a chance you could injure the tendon in your shoulder. A tear in your rotator cuff typically needs surgery. You'll likely have heard the term rotator cuff repair. This is where we go in with keyhole surgery and stitch the tendon back onto the bone to help it heal in the right place. If you're younger, this is much less likely as your tendons are more supple, so less likely to tear. It's useful to have an idea of the structure of the shoulder and how it moves and functions before we go into where things can go wrong. The shoulder is a complicated joint. It's made up of 3 bones: the shoulder blade, the collarbone, and your arm bone or humerus. Where the humerus and the shoulder blade come together, there's a big ball and socket joint. That's what we'd really consider the shoulder joint. And it's held together by the thick ligaments. Surrounding the outside of all this, there's a bag that we call the capsule. It's made of thick fibrous tissue and keeps everything together. On top of all that, and what is not shown on this model, are the big muscles and tendons that come together called the rotator cuff, and they drive the movement of the shoulder. And finally on top, where the collarbone and shoulder blade come together, is what we call the AC or acromioclavicular joint, and this is held together with very thick ligaments. A very common condition, but poorly understood, is frozen shoulder. It is most common in middle-aged people and often related to hormonal changes such as diabetes, thyroid disease, and menopause, so it's more commonly seen in women. It often starts out of the blue for no clear reason and makes the shoulder increasingly painful and stiff. Typically, you'll have horrible night pain and sharp, quick movements are agonising for a short while. In time, you'll also lose a lot of movement, so you can't reach back to things like your bra strap or reach up to a high shelf. The most common treatment for frozen shoulder is to have a cortisone injection, which is good for relieving pain as it reduces the inflammation. Alternatively, you could wait for it to get better naturally, but this can take up to a year. You could reach a point where you want to consider surgery, which opens up the shoulder joint by manipulating the capsule. As we saw earlier, the shoulder is a complex joint. A common problem as you get towards your 40s or 50s is to develop pain felt in the top of the arm. Now, although this is where you feel the pain, it's more often than not arising from an issue within the rotator cuff. Whether it's a tear or rotator cuff bursitis, which is inflammation and irritation of the tendons. This is often referred to as impingement. You may have heard people say shoulder impingement. This is simply describing the pain you feel as you lift your arm out to the side. This can be common with overuse due to sports, but can just be due to wear and tear from age. There can also be other conditions causing the same symptoms arising from the rotator cuff, such as calcific tendonitis or arthritis in the AC joint, acromioclavicular joint. Treatment can range from simply modifying your activities, changing the way you work out in the gym, and cutting back on any heavy lifting that's causing the issues. You do also have the option of a cortisone injection and physiotherapy alongside. But if these aren't settling your symptoms and we can see the problem on a scan, then we would typically suggest treatment via keyhole surgery. If you're wondering what to expect with something like keyhole surgery, then we have more videos on our channel exploring this. Arthritis of the shoulder is common and usually comes on in later years. You would feel deep pain, stiffness, or might even have a crunchy feeling. Pain during the night is particularly common if you've been active that day. Movement will feel uncomfortable and restricted. What's causing this is a breakdown of the cartilage in the joint. The surface of your joint becomes rough so that it can't glide easily, and this causes pain. Treatment ranges from painkillers to steroid injections with an added lubricant to help with movement as well as the joint pain. But if this doesn't give you enough relief over time, then, and lots of people aren't aware of this, you do have the option of a shoulder replacement. Shoulder replacement surgery is usually very successful as it quite literally replaces the damaged joint. This is what a shoulder replacement looks like. This titanium ball replaces the worn head of your humerus bone, and this plastic replaces the socket in the shoulder blade. A shoulder replacement would more often than not have you back playing golf, tennis or swimming, and will usually last at least 10 years. So, moving on to injuries and trauma. The most common injury in the shoulder is actually a dislocation, and for some people, it can become a problem with recurrent dislocations. Broken bones or fractures are generally due to sport, trauma, or an accident. Clavicle fractures and AC joint injuries, unfortunately, happen fairly often in the sporting world. Clavicle fractures quite often require surgery, whereas most AC joints just require a few months of rest, initially with your arm in a sling, so that the body can heal itself. So that was a brief overview of some common shoulder problems, what causes different types of shoulder pain, and how these conditions are commonly treated. If you want to come and see me for a consultation for specialist advice, or to talk through any treatments covered in this video, you can book online via the link in the description below, or search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, or would like a video on what to expect with a different type of treatment, please comment below this video as we'd love to hear from you. Otherwise, thanks for watching.